Dr. Frank Chinegwundoh is a leading consultant urological surgeon who specialises in prostate cancer, erectile dysfunction and infertility.
I've been a consultant now since 1996. I work at two NHS trusts, Barts and the London NHS Trust, and also at Newham University Hospital NHS Trust. So at both sites I see patients, I do clinics, I operate, I teach medical students and I teach the trainees in urology. At both sites I also do research work.
In addition, he runs his own private practice in London's Harley Street and is chairman of Cancer Black Care. Urology is a surgical speciality which deals with diseases of the urinary and reproductive tracts in men and with urinary disease in women.
Effectively widening the prostatic urethra. Urology is a surgical specialty and it covers diseases of the urinary system. So it covers diseases of the kidney, such as kidney stones or kidney tumours. It covers the prostate gland, that is prostate cancer, benign enlargement of the prostate or prostatitis. It covers testicular cancer. It covers other scrotal swellings, such as fluid around the testicles, called a hydrocele, or varicose veins of the testicles, called a varicocele. It covers incontinence. It covers erectile dysfunction. We deal also with infertility as affects the male.
Many of these conditions can now be treated without the need for an operation.
I would say probably half of the patients that I see don't actually require surgery. You know, we have lots of tablets, lots of medical therapies available to deal with the problem that don't require surgery. So, for example, if men who are having trouble passing the urine, you know, the flow is a bit slow, which we determine is due to an enlarged prostate gland. 15 years ago, all we had was surgery. But now, at least 3/4 of the men are dealt with satisfactorily just by taking tablets.
In fact, treating prostate problems forms a large part of Dr. Chinegwundoh's work. The prostate is a gland that can cause serious problems.
The prostate gland is about the size of a walnut, so it's probably about this size, and it's only men have a prostate gland. It's situated underneath the bladder, and it surrounds the water pipe called the urethra. So the urine exits the bladder through the urethra, and just at that point is where the prostate sits. The function of the prostate, what it actually does, it produces most of that seminal fluid that the man will discharge on ejaculation.
The most serious prostate condition is prostate cancer, and this is one of Dr. Chinegwundoh's specialist areas.
One of the things I'm interested in is to try and research as to why men get prostate cancer in the first place. We know that it tends to be a disease of older men. We know that if you have someone in your family with prostate cancer, you're more likely to develop prostate cancer yourself. But we also know that certain races are more likely to get prostate cancer.
As well as trying to understand more about prostate cancer, Dr. Chinegwundoh treats patients with other urological conditions.
If you pass blood in urine, that can be a sign that there's something seriously amiss. So a urologist would see someone who's passed blood in urine and do various tests to look at the kidneys, look at the ureters, look at the bladder in some detail. Typically, a young man might feel a lump in one of his testicles, and the urologist is a specialist that would deal with that situation. A big part of our work is sexual dysfunction, in particular male erectile dysfunction. So I would see a great many men who, for one reason or another, are having difficulties in getting their erections, and I will evaluate them and run various tests, and then decide on what treatment is best to try and restore their sex lives. If someone has a low sperm count or a man has no sperm at all, they would see a urologist to try and find out what the reason is and see if there's something correctable. And if there isn't something correctable, then it is possible to operate on the testicles and extract some of the tissue and extract the sperm from that tissue, which can be used for IVF.
Frank Chinegwundoh treats most urinary conditions. He has one clear message for anyone worried about urinary problems.
We deal with conditions that affect those organs. And a lot of the things that we deal with are things that people would find embarrassing perhaps to talk about. So one of the things that I say that, you should try and get over that embarrassment factor. There's nothing that the GP or us as urologists haven't seen before. There's no need to suffer. The country has so many urology specialists that are, only too happy to deal with those problems for you and improve your quality of life.